Mayroong konting problema kasi yung nilabas ng PhilHealth na PhilHealth Circular 2020-009, where they limited the healthcare benefit package. Pinawalan pa yung mga hospital na mag-collect ng excess or balance or what we call out-of-pocket or copay. Hindi mo pwedeng gawin yan sa private na pinagagalingan ng income ng private doon sa pasyente mismo.
That was Philippine Hospitals Association President Jaime Almora bringing up a problem with a PhilHealth circular which bars the co-payment scheme for some COVID care.
Co-payments is the fee to be shouldered by members in excess of what PhilHealth has covered. Hospitals warn without it, they might cease operating altogether. Good evening, I'm Gretchen Ho.
And I'm Robbie Alampay. You're watching The Big Story. More private hospitals in the metro are struggling to take in more COVID-19 patients, not only because of the high levels of occupancy, but also because of issues with manpower and finances.
Hospital groups reveal that a certain PhilHealth circular limits them from collecting co-payment claims, which in turn pushes small facilities to turn down some patients. Joey Francisco has the big story.
Online, there are many accounts of hospitals in Metro Manila being filled to the brim as COVID-19 cases continue to rise. Some even tell tales of hospital hopping just to get much-needed care. But data from the health department says there might still be some room. 70% of isolation beds and 80% of ICU beds in Metro Manila have been occupied in the past 24 hours. The Octa Research Group noted that the agency's hospitalization data does not seem to match with on-ground accounts of health workers.
So there are still supposed to be beds available for patients, but from the ground, I hear from doctors who work with us and from my sisters who are doctors also that their hospitals are basically.
But there might be a different explanation for the seeming lack in hospital spaces. The Philippine Hospital Association admits some facilities think twice about admitting COVID patients due to a PhilHealth memorandum. Speaking on One News' The Chiefs, PHA President Dr. Jaime Almora said a circular 2020-0009 limits hospitals from collecting co-payment claims from COVID patients.
Binawalan pa yung mga hospital na mag-collect ng excess or balance or what we call out-of-pocket or copay. Pero hindi mo pwedeng gawin yan sa private dahil pinagagalingan ng income ng private doon sa pasyente mismo.
Copay refers to a flat fee or predetermined rate paid by the PhilHealth member from their own pockets. This is in excess of what PhilHealth will shoulder. This does not sit well with the Private Hospitals Association.
What will we do if, let's say, the patient will not pay the excess? If the hospital will shoulder all the other expenses, then probably in a few days, all the resources of the hospital will be used up, and so the hospital will eventually stop operating.
As for the payment of other hospital claims, PhilHealth earlier said there have only been minimal delays. They said they're open to dialogue with private hospitals on claims that remain unsettled.
Insofar as turnaround time is concerned, we are not that delayed insofar as payment is concerned.
Spokesman Ray Balenya said the insurer is also in talks with hospitals on the around 5.6 billion pesos worth of returned or denied claims. Joey Francisco, we are One News.
With those concerns, how is PhilHealth faring in the country's uphill battle against COVID-19? To talk more about this, we have on the line PhilHealth spokesman Ray Balenya. Mr. Balenya, welcome to The Big Story.
Good evening, Roby and Gretchen, and to all your listeners. Hello?
Mr. Balenya, are you there?
Yes, good evening, Sir Jovi. Roby? Hello?
Is Mr. Balenya there?
Hello, good evening. Hello? Hello?
We seem to be having some technical problems getting on the screen with Mr. Balenya. We'll go to that later. In the meantime, the country has broken another COVID-19 record. Only this time, the Philippines logged its largest single-day increase in fatalities. That brings us to tonight's big number, 382. This is the additional COVID-19 deaths being reported over the past 24 hours that brings the country's COVID death toll closer to 14,000. Of this, the health department says 341 were recorded prior to April 2021 that were unreported due to a technical issue.
These are the other big stories tonight. Health professionals call for another extension to the enhanced community quarantine in the NCR Plus bubble. Failure to do so, they say, might result in a collapse of the healthcare system. As his pneumonia worsened, former President Joseph Estrada is now placed on mechanical ventilation. The former chief executive tested positive for COVID-19 last week. And some LGUs in the NCR Plus bubble begin rolling out assistance to affected residents. Most city officials prefer handing out donations in cash. These big stories right after the break.
You're still watching The Big Story. I'm Robbie Alampay. Let's get back to PhilHealth spokesman Ray Balenya. He's on the line. Mr. Balenya, welcome to The Big Story.
Good evening, Roby, and to all of your listeners. Hello.
Mr. Balenya, are you there?
Good evening, Roby. Hello.
Hello, Mr. Balenya. Welcome po to the big story.
Magandang gabi, Roby, at sa inyong mga tagapakinig.
Magandang gabi po. Kahapon po, kausap natin ng Philippine Hospitals Association. They were expressing some concern and they say some problems with the co-payment scheme. And sinasabi na it catches the hospitals in a real dilemma. Ano po ba ang tugon ng PhilHealth dito?
Roby, we have taken note of the Philippine Hospital Association's concern, no? In particular during our dialogue yesterday. So this was taken up during our dialogue yesterday. Alam niyo po, yung policy po that was contained in the said circular, particularly ano po yung costings for the COVID packages, were actually derived from actual cost data that was gathered from different hospitals treating patients with COVID last year. Ano po. And we can very well say that the packages reflect the true cost and therefore are responsive to the needs of our patients. This policy says that there should be no co-payment for the direct healthcare cost. So if the patient elected to avail of additional amenities, for example, they elected to stay in suite rooms, for example, then it's a different story, Roby. No? So there has to be co-payment, no, on the side of the patient. Mm-hmm.
Okay. Now, in the meantime, sir, if everything is going to be ironed out, assuming that everything works out, kamusta naman po ang PhilHealth mismo? How are our resources, and especially now na lumalaki pa ang problema ng COVID?
Well, our resources are still that robust, no, and we always we continue to assure the public that they will be able to continue availing of their PhilHealth benefits. So in 2020, we were able to pay, no, a total of 91 billion for all the claims that were filed with us, no, by our accredited healthcare partners. So we continue to commit ourselves, no, to afford our benefits, our members with these benefits, should they need this whenever and wherever.
Okay. Maraming salamat po, Mr. Balenya. That was PhilHealth spokesman Ray Balenya.
With hospitals in Metro Manila getting full, Marikina takes an unorthodox approach in preventing the further spread of COVID-19, reverse isolation. But what exactly is that? Mobile journalist Pam Castro will give us a front seat to the big story.
When we hear the word isolation, we often think that suspected or infected COVID-19 patients are the ones separated from the rest to avoid transmission. But as the cases go up, with the virus infecting everyone in the households, the table seems to have turned.
Marikina's COVID cases are spiking. From almost 900 cases, the city now has more than 2,300 cases last week. The virus has been spreading among family members, and quarantine facilities are now getting overwhelmed. To fight this, city officials changed strategy. If a household has most members infected, don't quarantine the majority. Instead, isolate the minority. It's called reverse isolation.
Kung sino yung nag-positive, kung marami sila in relation o kumpara dun sa nag-negative, ang ginagawa natin, ina-allow na natin silang mag-quarantine. At yung nag-negative, ina-isolate natin in a reverse isolation facility.
This means the infected family members must stay in their houses under lockdown for the duration of their infection. The one who is not infected will be monitored in a quarantine facility. This means less burden for the LGU and more resources to fight the critical cases. Marikina has already converted 8 schools as reverse isolation facilities.
We're here at Santo Niño National High School in Marikina City, which is one of the schools that are being used as a reverse isolation facility. So far, there are 4 families staying here and will be here until the ones in their households get re-swabbed and their COVID test results turn negative.
Omar belongs to a household of 24. He is now free of COVID, but his other family members also contracted the virus.
Then after nun, sila naman yung sunod na sinwab. Then sadly, lahat sila nag-positive. Then after nila, yung iba namin kamag-anak, lahat din nag-positive.
Now, Omar will have to wait for his infected relatives to get well before he returns home.
Okay naman sila, very accommodating. Kung ano yung needs namin, naibibigay naman po nila.
This was also the case for Rene. Some members of his family are still sick with COVID.
Lagi po kami sila na nakasuporta po sa amin sa lahat po ng pangangailangan namin.
Aside from food, vitamins and face masks, as well as alcohol are being provided by authorities. Mayor Marcy Teodoro says that the city needs to build more quarantine facilities. But in the meantime, the use of reverse isolation is helping to ease the pressure on the city's frontliners. I'm Pamela Vasquez and we are One News.
These are the other big stories tonight. Former President Joseph Estrada is currently on mechanical ventilator as his pneumonia worsened. This was confirmed by his son, former Senator Jinggoy Estrada. Ex-President Erap, who is turning 84 this month, was rushed to the hospital last week due to COVID-19. The vaccine expert panel wants to cut down the prescribed waiting period before COVID-19 survivors can get inoculated. The VEP is now recommending a 2-week waiting period for vaccination instead of the current 90 days after a person has been cleared of the virus. The panel explains a 90-day period is too long and 12 days is actually the optimum interval from the patient's recovery. The Interior Department has ordered the PNP to investigate the death of a male curfew violator in Cavite. The victim, Darren Peñaredondo, died after he was allegedly forced by authorities to do 300 rounds of body pumping exercises for violating quarantine protocols. However, General Trias Police Station denied requiring quarantine violators to perform exercises. Peñaredondo's live-in partner also admitted that the victim is suffering from a heart ailment. Let's pause for another quick break. More big stories when we return. Keep it here on One News.
You're still watching The Big Story. I'm Robbie Alampay. Several hospitals have already declared full capacity and are now unable to manage patients due to the surge in COVID-19 infections. Is the country's healthcare system nearing collapse? Jess De Los Santos has the story.
Selling the normal street food fare from Kwek Kwek to Fishball, Arlene's food stall in Tondo is ahead after work hours. But that's no longer the case for the past 2 weeks at least. Due to curfew hours in the NCR Plus bubble, Arlene is forced to close shop as early as 6 p.m.
Yun yung oras na mabili. Pero kailangan naming sumunod sa curfew dahil yun ang pinag-uutos ng ating gobyerno.
That's why she takes with open arms the 1,000 peso cash aid for affected residents in ECQ areas. Each household can also receive as much as 4,000 pesos.
Isang malaking tulong na yun, unang-una pambayad namin ng mga bills. Yun ngang last year, hindi pa namin tapos bayaran. Ito pa yung hinuhulug-hulugan pa rin namin.
Manila City received a 1.5 billion peso funding for the dole-out. The LGU prefers to hand it out in cash to allow residents to buy what they truly need. Several local government units in the capital region have already downloaded their allocated funds. Navotas City has 200 million pesos for 70,000 families. Payout will start either tomorrow or on Thursday, after duplicates have been removed in the beneficiary list.
Is yung SAP wait-listed beneficiaries, yung PWD, tsaka yung solo parents. So, sinisigurado natin na doon sa mga listahan na yan, walang magdodoble-doble.
Tiangco says those qualified to receive the financial aid will instead be given food packs. The same strategy will be applied in Caloocan City, which received at least 1 billion pesos. Other cities will augment their budget. Marikina received 384 million pesos, good for 80,000 families, but their SAP beneficiaries total 113,000.
Re-realign kami ng budget. Marami daily wage earner. So mawalan ng pag isinara ang trabaho, wala nang kinikita.
Cities like Mandaluyong, Quezon City, Parañaque, and Taguig will begin their payouts tomorrow. Pateros is slated for Thursday or Friday. LGUs are given 15 days to release cash assistance upon receipt of the funds, or within 30 days if the aid is in kind. In an interview with 1PH Totoo Lang, DSWD spokesperson Irene Dumlao said that an executive order must be issued first before the aid distribution.
Sa local budget circular na inilabas po ng DBM that the local government units have the discretion to distribute the assistance either in cash or in kind.
The DILG also warned against using the distribution of ayuda for politicking. Administrative charges may be filed against violators.
Pit pong ipinagbabawal ang paglalagay ng mga pangalan, ng mga initials, or kaya naman picture, o kaya naman logo, or kahit anumang imahe ng ating mga politiko o local officials habang pinapamahagi itong mga ayudang ito.
The public is also encouraged to report to authorities such instances, along with documentary evidence to support their complaint. Joint monitoring and inspection teams were also created to address constituents' financial aid-related complaints or grievances. For News 5, JC Cosico, we are One News.
Kaya pala may liniment dito eh. Tita, mabila yun.
Dati, abs lang niya ang pandesal. Ngayon,
With stereotypes such as aerobics, cutex, pamamalengke, maintenance meds, and rheumatism. Tita Julie herself is not impressed and turns the man-shamer into a pandesal. The bake shop ends with a strong pronouncement that, like Tita's, its products remain fresh at 40.
Kaya pala may liniment dito eh. Tita, mabila yun.
Sa mga tita.
You know what? After everything that has happened to the world, I feel like that RC ad is not so bizarre anymore. And even that last bake shop. Just go outside and see more bizarre things.
Everything is normal nowadays.
Ay, nako. And that wraps up today's big story. Catch us again tomorrow on Signal Channels 8 and 250.
Please like our Facebook page, One News. For more in-depth analysis, visit our webpage, onenews.ph.
Mask on, wash hands, and stay safe, Philippines.
And stay negative, but be positive. Kaya natin to. I'm Robbie Alampay.
And I'm Gretchen Ho, and we are One News. Have a good evening.
Good evening.